Talk to me. WSRadio.com.
Welcome to Performance in Motion with your host, Dr. Dennis.
Okay, folks, we're back for our second segment with Dr. Brenton Wynn, martial arts expert and board-certified physical medicine and rehab doctor and pain management doctor. And he was just sharing a story with us towards the end of the last segment. And we're going to get to that in 1 second. I just want to give his contact information to make sure we get that there. His website is Wynn Over Pain, WYNN, overpain.com. And the number to contact him is 619-434-4019. All right, Dr. Wynn, let's finish that story.
All right, so we're going to the story of how did I find my way into the world of medicine.
Yes.
And, as a youngster teenager, I was training in the martial arts, and I, like any other martial artist, I was looking for a way to be better, faster, stronger, and just kick some butt. So basically, I started looking into. I remember grabbing Muscle Fitness magazines and pulling out the little insert kinesiology with the the little exercises and the muscle group that it functioned with. Yes. So I would take that, and then I read about a supplement, and then I read about a vitamin, and this is what Olympic runners are doing, and this is what Olympic swimmers are doing, and so I tried to absorb all of that and use it for my own selfish means, right? Kind of fall in the path of the dark side, right? But all of that started to propel me into looking into this in school, and then when I went to UCLA, I started as a biology major, and I just found it not as interesting as I thought it would be. And when I heard about the Department of Kinesiology, and they had classes like exercise physiology and neurosciences, I said, you know what, this might help me become a little better martial artist. I was interested in life sciences and healthcare and health and fitness. So it was kind of a natural progression to go into the medical field. But I remember kind of thinking about what to do next when I was at that time in my college career, and everybody in my major was applying to medical school, dental school, physical therapy school, or they were deciding to do some benchtop research somewhere, and I said, that's a little too boring for me. I can't sit in a lab all day.
Right.
Physical therapy that would be good. I could see myself doing that. Dentistry, I like that. My father was in orthodontics, so I had just a natural affinity for that. But I kind of stepped back and said, you know what? I've never heard of sports dentistry, but they do have this thing called sports medicine. Let me see what that's about. And so when I was successful in taking my NCAPs and applying for medical school and being accepted, and just followed it from there. I think when I was in medical school, we had this course called Introductory to Medicine. I think it was in our second year. Introduction to medical care, something of that nature. But basically, it was once a week they'd have a presenter from every different specialty come and talk to the students to kind of do a 1 hour lecture on what they do. And there was a physician that came, and he said he did physical medicine and rehab. And he talked about what he did, and he said, and I write prescriptions for exercise. And I said, prescriptions for exercise?
Nice.
Let me find out some more about this. So I ended up really becoming interested in physical medicine and rehabilitation, and eventually was one of a handful of the students that actually matriculated into that as a specialty. And from there, that specialty, my specialty, kind of focused on. There's two aspects of it. There's an outpatient and an inpatient aspect. So the inpatient aspect We primarily focus on spinal cord injuries, brain injuries, traumatic brain injuries, stroke rehab, and any other neurodegenerative disorder that would require someone to require extensive inpatient rehabilitation in order to be able to go home and function at their highest level,
yes,
and be as independent as possible in the community or at home or whatever roles that they performed. So the outpatient aspect of that was more of the physical medicine. That's where we were doing the pain management, spasticity management, sports medicine, electrodiagnostics. So when I left Stanford, I did my fellowship in interventional spine musculoskeletal medicine, and one of the little bullet points on the fellowship program was sports medicine. So of course I'm always attracted. I've always been attracted to that. So I had an excellent year, excellent preceptor that I trained under, and so now following that program, I am considered a interventional physiatrist.
Ah,
yeah. So a lot of people ask me, interventional. So what is that? You're a physical therapist? No, not a physical therapist. Oh, you're a psychiatrist? No, not a psychiatrist. I'm an interventional physiatrist. So physiatry or physiatry, depending on what part of the country you come from, is the specialty of physical medicine and rehabilitation.
Okay, that definitely makes sense. So, wow, felt like I was at a dissertation by the United Nations coming together about sports medicine, but that was great information. So I guess my question with everything that you just shared, what are some of the interventions that you use for pain management right now?
Right now, I like to use what we call multimodal therapy. So basically, we're integrating a number of different ways to address a pain problem or a functional deficit. So the first one that everyone probably thinks about is pharmaceuticals. So just like any other physician, I write prescriptions for medications dealing with whatever the condition may be. If that's a pain issue, we have a variety of pain medications to use. If it's a anti-inflammatory, if there's a spasticity or muscle spasm problem, we have other medications for that. So medication management.
Okay.
I absolutely want all of my patients to be optimally functional, so I look into the different therapy modalities, whether it's physical therapy,
yes,
for movement issues, occupational therapy for some of the activities of daily living, or speech therapy if there's some cognitive or speech issues. So I work closely with those specialists. I myself, with my background in interventional medicine, means that I do interventions, which are primarily different types of image-guided injections for focal treatment of pain. So if you have a rotator cuff issue, I can localize that, inject corticosteroid, anesthetic, or a number of other agents to help treat the symptoms.
Yes, actually, folks, Dr. Wynn was kind enough to allow me to come and observe him in action. And I have to tell you, I've been in the medical field for over 30 years, and I want to see more. A tremendous amount of skill involved, and Dr. Wynn has the type of personality that he can get along with anybody, and he keeps you at ease, which, in my opinion, a lot of the medical professionals don't have that. I'm sorry, but it is compassion, and it is empathy.
Yeah, and I think about it as, when I started in my journey, and especially being attracted to physical medicine and rehabilitation, I thought to myself, if I have this condition, what would I want? Would I want someone to tell me, no, you got to have a surgery? No, I want to find out what are all of the other things that I could do before perhaps doing that, if that's a possibility. And so I try to provide, non-invasive alternatives for all my patients before we move on to some of the more invasive treatments. Also, energy medicine is another aspect that I use. So if you think about it, acupuncture is actually an energy medicine.
Okay.
I also use, a combination of chemical electrical therapy and cell signaling therapy, which is a new device that we have in the office, an energy device that we combine with injections that actually allows tissue healing to take part. The other therapy that I'm really interested in, I've done this in the past, and we're just reintegrating this in the office again, is regenerative therapies. That's where we're using platelet-rich plasma and stem cells, again, regenerating and helping to heal the tissues.
Nice. I mean, folks, I know that a lot of you out there have seen the research and tremendous articles on the two therapies that Dr. Wynn just shared with the platelet-rich plasma. Boy, that's hard to say 10 times. Can you say that fast, Dr. Wynn?
That's why I say PRP.
Okay. See, I'm learning every day from the doctor, so it's continuous. And in the next segment, we're going to go into detail about the new therapy that Dr. Wynn had shared about 30 seconds ago with the electrodes. And sometimes he speaks really fast, so we'll definitely get it so that we can grasp it. And from what he's telling me and the little bit of research that I've read, he's getting tremendous results with his patients. And in the next segment, we're going to go into detail. So it is Dr. Brenton Wynn, and his website is wynoverpain, WYNN.com, and it's 619-434-4019. See you next segment.
Thank you for listening to WS Radio. Improve your business and your life with useful information from experts and thought leaders. WS Radio is radio with ROI.
Are you losing the battle with technology? Tired of struggling with IT? Ready to meet your IT dream team? Centrix IT is Southern California's leader in IT management. A 4-time winner of San Diego's fastest growing privately held companies, Centrix IT has provided Fortune 500 managed IT services to small and medium businesses for over 13 years. Put an end to your struggle with technology today at CentrixIT.com. CentrixIT.com.
Life is full of misadventures, from car crashes to home fires to getting choked out on the mat. Yes, I said getting choked out because I'm Carlos Kramer, jiu-jitsu competitor, MMA and media personality, and mild-mannered insurance agent. You can follow my adventures on Kick-Ass Radio, and I can protect you from life's misadventures at Kramer Insurance. Home, auto, life, business, and workers' comp. We're at KramerINS.com, and I want you to join my world.
Are your feet hurting you? I mean, really hurting you so much that you can't come to the fair and enjoy other activities with your friends? If so, you may have plantar fasciitis, a chronic inflammation of the connective tissues in the foot. I'm Holly Halsey. I'm a licensed acupuncturist, and I can help you with your pain. I invite you to visit me at my webpage, AccuSageHouseCalls.com. That's ACUSSAGE, housecalls.com. Find out what pain-free feels like.
Hi, this is Rob Barnett, VinVillage.com, where wine lovers connect. Be sure to tune in weekly to Vin Village Radio for exclusive, in-depth interviews with the who's who in wine and food.
Do you want to be a professional coach? Are you in business trying to make a real difference with people you manage or work with? Have you started a coaching practice that isn't quite getting off the ground? Get the skills you need to be a successful coach today with the Coaches Training Program from Accomplishment Coaching. The Coaches Training Program will show you how to help others focus and be more fulfilled. Whether you want to improve your company's bottom line or create a thriving coaching practice, Accomplishment Coaching can give you the distinctions and practices you need to coach others effectively today. Accomplishment Coaching has spent 6 years developing a cutting-edge coaches training program that will have you ready to coach people professionally in just 12 months, and you don't have to take time off work to do it. To find out more about the Coaches Training Program, just call 1-888-548-6813. That's 1-888-548-6813.